Hey, welcome to the Intuality AI podcast, the podcast that gives you insight about data, and specifically, right now, of course, we're focusing on data from the coronavirus. I'm Dr. Howard Rankin, host of the Intuality AI podcast, and I have with me, as usual, the founder and chairman of Intuality AI, Grant Rainier. How are you doing, Grant?
Okay, we're somewhat harried trying to keep up with the programming that is pulling in what we hope is the best source of data so that we can use our technology to make projections. But right now, we're just focusing on, in this podcast, as you know, telling people how they can go into the internet and find a good reference for the most current status of data about the virus.
Good. So let's go straight to it. We have a favorite program that people can all access on the internet, and that is the Johns Hopkins site. And they have been providing data for a while now from around the world, and of course the US, looking at cases confirmed, number of deaths. So where would you like to point to first, Grant?
Well, I'd like to start up in the upper left-hand corner where these are right now the total confirmed deaths worldwide. And this is coming, what you're looking at here is the dashboard or the website that is produced and maintained by a section of Johns Hopkins University. It's their Center of System Science and Engineering. And this is somewhat of a real-time update of carefully carefully studied data, making sure that they're getting good data. And I'm going to update it right now by clicking on the refresh up in the upper left-hand corner of the browser. And it's showing that at this point, we've got worldwide a total confirmed number of cases of about 460,000 individuals.
Okay, so when we look at that data and we say 460,000 worldwide, what does that really mean? And what are the limitations of that data as far as we know? Are there?
Well, this is basically being collected from lots of different sources worldwide, and the information that Johns Hopkins is getting is being verified to the extent that they can verify it, and then being put up on the this website of theirs to show what that amount is. And this site is being automatically updated roughly about every 10 or 20 minutes. And so when you go into it and let it sit like this, you can see what the status is, but you do need to refresh it very often. And as I said, the 460,000 is worldwide. And below that number is a list, as you can see, starting from the most cases, that in this case is China, down to the lesser. The next one down is Italy, and then the United States. So if I was to click on the United States at this point, what we're going to see is the current number of cases in the United States, which is 62,873. And the other ones are shown for the other countries as well in this list.
Okay, so these are confirmed cases. Now, there's obviously going to be an unspecified number of people who have the virus, but that has yet to come to notice of authorities and therefore has not been confirmed. So these are just the data of people who absolutely have been confirmed. Yes, you have the virus, correct?
That's correct. And we would all know that there are probably some extra group out there that have the virus, but for one reason or another, they are not reporting it. They're either staying at home and weathering their way through it, and it doesn't get into these numbers. So one would guess that these numbers are somewhat of an understatement of the total confirmed that you see here.
Right. But it's certainly a good guide as to the growth of and the contagion of the virus as you follow these, and as we have, watched those numbers go up, often fairly considerably each day, you certainly get a sense of how fast this is spreading.
Yes.
Okay, what do you want to point us to next?
I'd like to go to the middle chart here. This is a what's commonly called a bubble chart. In this case, the red bubbles, the red circles, are showing by their size, basically, the number of cases in that particular part of the world. So if I was to drill down, let's say, into North America, and which I'll do by hitting the plus sign here, we can see that in some cases in the western part of the United States, there are little tiny red dots, but on the coast, especially the East Coast and the New York area, there are many large dots, and these, by their size, tend to indicate the number of confirmed cases.
Yes, and you can really drill down on this map if you want to. You can actually go to almost street level, not data on virus contagion or death, but it is a map that you can. It's amazing. Go to any part of the world and drill down and find the names of the streets and the intersections, as what you're doing here. And of course, those maps do, of course, have data about those areas where there are outbreaks. And that's actually, I think, very useful and very helpful for people. They can look in their own area and see what is actually happening in terms of outbreaks.
That's correct. Now, if I want to see specific numbers about each of these, what I can do is go back to this list on the left side and go down to the bottom where there are three indicators here. One is admin 1, and there's admin 2, and admin 3. And admin 1 is the level that we're looking at here. This is the overall macro level. If I hit admin 2, then we get a change in the list here that in this case is listing in descending order the number of cases in the US. And this is by state, as you can see. So New York is leading at this point with about 30,000 confirmed cases. If I click on that, that number will be showing up here under total confirmed. And if I want to see even more, I can go over to admin 3, and I can get down to very specific areas of New York. In this case, New York City has 17,856 confirmed cases. Westchester County, 4,691 cases, and so forth. So this is a very powerful tool that they've got that allows you to go in and out, depending on where you live, to find the very specific cases that are confirmed at this point.
Yeah, interesting. At this point, New York City has what you said, like 17,000 cases out of 60,000. So they have 30%, about 30% of the cases in this country are apparently in New York City at this moment. So it certainly seems to be the center of the virus as far as this country is concerned.
That's correct. So if I go back up again to the US and click on it, this will again bring up the number for the US. I might have to refresh it here to have that happen. So we'll do that. And click on the US again. And here we're going to get back up to our number of 62,000 for the United States. And so you can do this for any part of the United States and, of course, any part of the world. So it's a rather powerful tool to get what we hope is the most culled data and recheck data that's available.
Okay, so let's move to the other side, the right hand of the screen, which looks at total deaths recorded. And before we go into that, we should say that probably deaths are more likely to be recorded than case confirmation. As you said, people may have symptoms and not want to go into the hospital or not even realize that they have them. The death rate recording's probably going to be a bit more reliable, right?
I think so, because obviously deaths become a matter of record, and through the normal system of recording deaths. And so we would tend to think that this is a more accurate data. And therefore, there's probably a lag, undoubtedly a lag between the current number here of 894 for New York and the 62,000 cases in, well, in this case, I'm sorry, I've said New York. I meant for the United States, the 62,000 confirmed cases. So there's a definite lag. So if you take a percentage between the total deaths and the total confirmed, you probably get an over result that overstates the percentage of deaths per confirmed.
Yes, I think that's a reasonable assumption, that the death rate per se is still very difficult to work out. But something I do want to point out about the death rate is there's a lot of misinformation going around on social media, particularly people who are looking to, for whatever reason, and maybe justifiably, trying to downplay the panic and what have you. And I've seen more than once people compare the death rate from the virus to death rates from suicide and road accident fatalities. And the problem with the data they're presenting, they're saying, well, this year, so we're in 3 months this year, there's been, X thousand suicides and X thousand fatalities on the road, but we only had 500 coronavirus deaths. Well, that is totally a false comparison. The coronavirus has only been here a couple of weeks, effectively. And so what you would really have to do is compare daily rates if you really wanted to make that comparison. And these are sad statistics. The average over the last few years, the average suicide death rate has been about 120 a day. The average motor fatality a day in the US is anywhere between 102 and 110. So both of those are a little over 100 a day, which is tragic. And then people are looking at what is the daily coronavirus death. And I was just looking at that and just saw that in the US, on the 18th of March, which was actually less than a week ago, there was 40 new deaths. The next day, there were 56 new deaths. The next day, 49. The next day, 46. So someone looking at that say, well, you see, I'm right. There's nowhere near the number of even suicides or fatalities. But on the 22nd, that number jumped to 113 new deaths. The next day, it jumped to 141 new deaths. And yesterday, it jumped to 225 new deaths, which is about the same as the average suicide motor fatality rate per day. So again, when you see that comparison, you've got to compare day by day and what's going on. And clearly this virus death rate is going to accelerate. The problem is we don't know how much, and we don't know when we're going to flatten that curve and reach the peak, right?
That's correct. Yeah. We've got a certain growth that's going on that where everybody is making their assumptions about what that growth rate is, and it's important to take a hard look at the numbers and make sure that we're not overstating or understating what the growth is in terms of, in this case, new confirmed cases of coronavirus. It's been reported, for example, by some of the news media and principals of the news media that new cases are doubling every 2 days. In fact, I heard that in a news conference with the president yesterday. And if in fact that's just not happening. And these figures here indicate otherwise. It is doubling, and it needs to be given attention, but the doubling seems to be at the worst somewhere around every 4 days up to about every 10 days, depending on what area of the country and what area of the world you're looking at. So that means that in terms of extrapolating that number out, means a great deal, because if we made some calculations that indicated if it was doubling every 2 days, that within 14 days, within 24 days, the entire population of the entire world would have the coronavirus. And of course, we know that's not going to happen. So doubling every 2 days just isn't fact. Something somewhere between 4 at the worst and maybe 10 or 12 at the best.
And that's for new cases, right? Confirmed cases.
That's correct.
Yeah. So right now, as you see the screen, we have 62,000 confirmed cases in the US. So what we're saying, Grant, is that in 4 days, that number's probably going to be 125,000. It will double in 4 days, right?
In the worst case, it could, yeah.
Mm-hmm. Yeah.
I want to go to this chart that's down in the lower right-hand corner.
Yes, good.
And this is the chart of the confirmed cases. And if I hover over the most current marker on the chart, it shows that on the 25th, on the 23rd, there were almost 54,000 confirmed cases. Now, half of that, let's say for the sake of argument, might be 25,000. And so we backtrack through the chart until we hit 25,000. And that's going to be somewhere back in this case, on the 20th. So there's between the 20th and the 23rd, there's been a doubling. So that's probably the highest rate that we've seen. And we'll see where it goes from here.
Absolutely. And I think when we get those data, I think it might then be, I think we're going to see prediction models coming out, and certainly Intuality AI is working hard to work on the available data, get as much of the reliable data as possible, and hopefully then start looking at what this really means in the longer term, correct?
Yes, our function and our technology is to predict the future from data like this, and we are applying this data to the system. And so within a few days here, we're going to start making and being able to demonstrate what our system thinks about the future. And we're predicting into the future somewhere around 15 to 30 days at a time. And so our curve will add on to this one and either continue the curve up or more sideways, or maybe at a higher rate. We don't know until we do it. But we think being able to produce those charts and see what our technology and the others are doing the same thing, what our technology indicates is coming within the next 15 to 30 days.
Yeah, and hopefully that will be helpful. Now, I can direct people to where they can find previous charts that we've done on this at intualityai.com. And these charts will be posted there, and you can also find out a lot more about what Intuality AI does in a variety of different venues, not just in the health venue. And Grant, perhaps it's now time to show people where they can actually find this Johns Hopkins chart.
Absolutely. Okay, I will put up here the information that anybody can use to access the site that we've just been looking at. And again, it's the site that we recommend There are other sites that you can go to, but this one seems to be of high quality. So it comes from, as I said, Johns Hopkins University Center of Systems Science and Engineering. And you can type into your browser these words, which is coronavirus, COVID-19, 2019-nCoV. If you put that in, it will take you to this address and immediately bring up the dashboard or the website that we've been looking at. So we urge everybody to take a look at that if they really want to see the data as it's coming in. And with these days of us all being somewhat sequestered, we might have time to do this and keep track of what's going on in the world.
Great. We hope that this has been helpful to you. We certainly think it's a very useful source of data and information. And we will be back with you in a few days with more data to analyze and look at. But hopefully this gives you an understanding of not just where you can get these data, but what it actually means. So for now, thanks for watching, and we will see you in a few days. Take care.